This is David Holt, IV consultant. Today's subject is cephalosporins and how to give a full dose of IV piggyback antibiotic. So cephalosporins come in multiple generations, 4 or 5 generations. Two of the most popular are Rocephin and Fortaz. Rocephin often comes in a 50 cc bag, and so to get the entire dose into your patient, you're going to need to program your volume to be infused using a 2 IV tubing system for 80 cc's at least. That takes advantage of the Holt 30 cc rule. The volume in the bag 50 plus the Holt 30 cc rule, which 30 cc's gives you 80 cc's for the volume to be infused section, and you should be able to give the entire dose of the antibiotic. Fortaz often comes in a 100 cc bag, although it does sometimes come in a 50. When it's in a 100, you'll need to use Holt's IV rule number 2, and that simply requires that you add the volume in the bag as stated, plus 10% for the overfill, plus the volume of both IV tubings. The secondary is usually 8 or 9 cc's and the primary about 22 cc's, and that should give you about 140 cc's, having factored in the original 100 cc bag. Sometimes it's as much as 145 cc's. If you have extension tubing, you also need to add that in. So your VTBI section requires about 140 cc's in it, and your flush bag of course needs to have at least 40 to 50 cc's left in that bag before you start your pump, or else the IV tubing will still run dry. I think that's all on the cephalosporins. I'm not going to get into side effects, things you should be looking for. That's problems for other people. My focus in my books and my website is getting a patient the entire dose of the IV antibiotics. So please make sure you check your labs, check the correct patient, check that it's still appropriate, that the cultures have not made a significant change to your situation, and give the entire dose. Thank you for listening, and I hope you'll check out the book or the website rn-ivpb.com.